Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst, and my co-host. And we have a guest, a fabulous guest on with us today. So we're going to go ahead and Faraday, go ahead and introduce yourself.
Hey guys, Faraday Golimbieski, nurse practitioner here at Revitalize MD. And today we have an amazing podcast with a very special guest. And I'll let you go ahead and introduce yourself.
You lovely ladies are far too kind. I'm Dr. George Ibrahim. I'm at Asheville. I'm in Asheville with Biltmore Restorative Medicine. I've got a background in urology, and I've been doing sexual wellness and hormone optimization for about a decade now.
And he's fabulous and a wealth of information, and we're lucky to have him on. And we're going to talk about boric acid today. So it'll be something, actually, there's quite a few searches on this. So it'll be a lot to talk about and cover. And I'm interested in
looking up information today.
I know, me too. I'm interested in hearing what Dr. Ibrahim has to say about it. So boric acid and vaginal health. Again, kind of a historic treatment that's been around for a little while, but it's, I think, like getting more attention lately. Yeah. So what's your take? Is this something you use frequently?
All the time.
Really?
Not myself, but you know,
without a vagina, you didn't need it.
The very first thing is the word acid. Our ladies, do not worry about it. We have orange juice, citric acid. We cook with we use vinegar, acetic acid. I mean, there are acids used in all sorts of things that are totally fine. So the word boric acid does not mean something that's going to burn or hurt you. It's no different than like orange juice or vinegar, things like that. It's an acid, not a base. So boric acid is a way of helping to restore vaginal pH. The acidity and baseness of a vagina is a very delicate balance. Mm-hmm. Every woman has her balance, and there's things that are going to disrupt that, and we'll talk about that as we go along. But that's what boric acid does, is it helps restore the natural pH of a female's vagina.
Well, and so do they frequently, because I at least saw one GYN doctor, again, traditional medicine mm-hmm. does things a little bit differently. Mm-hmm. And so they like to do the traditional medicine route and not compounding pharmacies. And then they talk about these over-the-counter preps. So when you're using it, you're talking about compounded boric acid?
Or even over-the-counter. I mean, I'm not here to recommend a certain brand, but it's available. You can get it on Amazon. You can get it at CVS. You can get it pretty much anywhere. It looks like a pill, but it's not to be taken by mouth. It's to be inserted into the vagina. It's a suppository.
So that was one of the big things. Don't take it orally.
It says a vaginal suppository, don't take orally. I'm like,
yes.
Wow.
And we've had quite a few patients that did.
Okay.
It doesn't hurt you. It's just not going to get the effect that you're looking for.
Blows my mind that you have to say don't take oral after vaginal suppository, but or intravaginal.
Well, then I think they were talking about, it's again used for like killing insects and all this
pesticides.
Yeah, like the horrible. So again, it's almost like the horse stuff early on. Like it's a scare for some patients, and so it's an acid, but it's something that again,
it's a mild acid.
It's a mild acid. Yeah.
And the vaginal pH, teeters in that area, and it helps bring things back to balance. So what happens is today, more and more, back when we were in med school, Deborah, I remember one of the chief residents giving the lecture, and the word promiscuous was defined as 4 or more partners. She goes, so boyfriend freshman year, different boyfriend sophomore year. So by the time I'm a senior, I'm promiscuous. In other words, it's not that big, 4 is not a huge number, right? But that's what it was defined as when we were growing up. And different salivas, different semens, different condoms, different lubes all have different pHs. So if a female is around different partners using different condoms or different lubes or
exposed to different pHs,
different pHs, it doesn't take much to get things out of balance.
Well, and I think that even when I've listened to the GYN videos. Again, they're talking about like, don't do any of this by yourself, go partner with a physician before. But if you're talking about different partners, different lubes, frequently just a mild odor, not irritation, can throw off it can be a pH thrown off. Doesn't mean anything bad. You can't go seek medical care every single time.
Exactly.
You might notice something slightly different, right?
Exactly. And it can be anything from you go on vacation, you're wearing a wet bathing suit for a lot longer than you normally would. And now the woman complains of having a UTI. 99% of the time, it's not a UTI. She's just gotten the flora out of balance. And, doing a boric acid at bedtime, wake up, things are refreshed. I mean, it literally is like a first aid kit for the vagina.
We have to
That's
laugh
awesome.
because this was awesome. We have the title because it was first aid for the vagina. Well, maybe other terms slightly, but we'll use some asterisks in there for sure. But the bottom line is you're right.
It should be in every woman's travel kit at least.
Yeah.
Who wants to be away from home and things are itchy or malodorous? And a lot of times all it is a pH issue.
So what about those women that are prescribed like macrobid to take every single time post-sex?
Or pre sometimes to prevent.
Or pre.
Or prophylactically on
a
daily basis. I don't know if they're still doing that, but they did that for a long time too.
I mean, I know quite a few women that are told to take macrobid.
And this would be something that I would say,
try.
First of all, try this. Let's go back to macrobid for just a quick second without boring your audience. Macrobid is what's called an antimicrobial, which is different than an antibiotic. And it makes the urine inhospitable for bacterial overgrowth. The reason why urologists like macrobid is you don't get all this resistance and you don't get yeast infections grown on top of wiping out all the bacterial stuff that's in the vagina. So that's why we like macrobid for the woman pretty much every time, let's just say she has sex, she gets what she thinks is a UTI. Boric acid could help just as well.
I was going to say it would do the same, right?
Yeah. Mm-hmm. And so I would definitely try it. And if the boric acid doesn't work, macrobid's not a bad fallback. Way better than antibiotics every time somebody has a little twing down there after sex.
So I think, again, an antimicrobial or antifungal in boric acid works for both. And again, those resistant. So then it comes down to medically. So if you look at them, if you have a vaginal discharge and you're sexually active, new partners, multiple partners, then of course you want to be evaluated to make sure it's nothing sexually transmitted, right?
Or something like that, of course.
But it's those that are frequently or with the same partners, maybe just changing up something mild and they're getting symptoms recurrent, then, if you've already been evaluated to rule out all the other bad stuff, then you don't want to seek care. That's what we mean by not seeking care on a regular basis for a slight change in product. And this is safe. Now, there are studies that have shown safety and just as effective as like metronidazole, for instance, for bacterial vaginosis.
Or diflucan for those that are familiar.
For the candida or for yeast. Yeah.
So let's just say somebody has a productive weekend, and there's somebody new that's been around. That's not always a UTI the next day. It's probably a pH difference. Because again, saliva changes it, semen changes it, condoms change it, the lube changes it. Then if you mix any of those in combination, you've got a big change going on.
Yeah.
And pH is a logarithmic scale. I mean, a small number change is a big change when it comes to pH. And you can always go to the antibiotics later if the boric acid doesn't work after a few days. If it doesn't, if you don't see a resolution of symptoms, then maybe go see somebody. But this is going to help a lot of women not go to urgent care every time this happens.
Well, and then again, it actually is treating persistent, recurrent. Like, so some of the indications for it actually in medicine, and they will do compounded versions of it, or the over the counter, is persistence, bacterial vaginosis, persistent yeast, non albicans yeast, like the typical ones. So so recurrent would be a reason to put them on it. So I think if you're getting those recurrent symptoms, you've been evaluated, no major changes in partners or risk, then, some self-treatment at home is not unreasonable. Yes.
And let's talk about bacterial vaginosis for just a second. Because that unfortunately gets listed under the category of STDs or sexually transmitted disease or whatever the new abbreviation is nowadays. But it's not, because a lot of guys get in trouble for this when their woman is going through menopause, because menopause leads to pH changes. And the woman comes back and she says, my doctor, my nurse practitioner, my physician assistant told me that I have BV, vaginal vaginosis, and that's an STD. What are you cheating on me? No, men can't carry it. Men can't transmit it, but it gets listed under STDs. And as a woman goes through the change of menopause, BV is a big issue. Boric acid is the treatment for it. It fixes it all the time. And don't blame your man because he didn't bring something to you. But no, I get this all the time from guys, that they're being accused. Men cannot transmit or harbor BV.
And it is the most common, cause of discharge. Actually, and again, overgrowth of bacteria, a lot of times Gardnerella, but a lot of times they cannot figure out which one it is. They've been to their, GYN and they don't have a specific diagnosis. And yet, so there's no reason to scare people away from boric acid, which is safe and works on lots of.
Something that's natural, absolutely, before taking antibiotics.
Yeah, no, correct.
Absolutely. Any contraindications, anyone that this wouldn't be great for?
Just don't do it orally. That's all.
Right? Just don't swallow the gel tab.
It's just not going to work.
Well, and I think if ever anyone was to be scared, again, if it's used for other things than caustic reasons, then just don't do it orally. And oral sex, maybe, while you're taking it, or at least let your partner know. But the other thing that I didn't see anyone talk about was the changes that increase, that are magnified with perimenopause and menopause. So insult to the vagina is very common when you're younger, which is why insult does not change your pH and affect it as much as when you're younger. But when you start to go through changes and your hormones are declining, your pH can be thrown off by anything. Your vagina no longer handles insult like it used to.
Exactly.
And so,
that's why we talk a lot about water-based lubes and staying away from flavored or other forms that can cause issues, because women just don't tolerate as well.
Coconut oil. Staying away from.
Oh, because it's organic. And
it's meant to be in your pantry, not on
a dollop of coconut oil doesn't do it for everyone.
No, and it's the all natural women that want to have coconut on their nightstand, and they're like, I'm just using my coconut oil. Well, again,
take that and bake a cake with it.
But no, because it really is going to throw off your pH as you get older. And so again, I think perimenopause and menopause, it's a game changer, because you cannot go to the GYN doctor enough, because every little change, especially if you're not hormonally balanced, is going to be.
If a woman's not hormonally balanced and she's going through menopause, this is going to happen all the time. All the time.
Yeah. No, I
Sex, agree. Wet bathing suit, like I said. I mean, just anything.
No, I agree. And so I think, anything else specifically you think about boric acid that you think of, that you run into, questions you run into on a regular basis with your patients?
Oh, no, they're always asking, like, how many? I go, just read the label.
Yeah, exactly.
Follow the directions on the box.
Yeah. Well, and it's like that with supplements too, because every supplement's different. And so they're like, well, how many should I take? And it's like, just read it. Yeah. If it says 2, then take 2, because it's all different. Yeah. The ingredients are different in each one of them. So I agree. And then you can have it compounded too. There's always compounding for it. You just want to make sure that you're getting a vaginal prep because the pH is balanced in those products. So, and that's key. That's what we're trying to maintain and fix. So, what I do want to do a podcast on at some point is maybe silver and using silver in some ways because
colloidal
silver, because it's also antimicrobial. And I don't know if it has quite the pH effects, but I did see some stuff on HPV, which, kind of brings us to that whole HPV, which is a whole podcast in and of itself.
Oh,
and clearing it and the misconceptions of men and women. And, I have women that have been HPV positive, which are mostly going to clear. And then they're concerned because their, significant other gets like, a pimple pink, spot on their penis. And it's not the same and as genital warts. And so it's just a huge myth and misconception out there in the general population. So it'd be great to do a podcast on that at some point.
Grab me on that one. That's if you Google Scholar me, that's where my research was. A lot of it had to deal with HPV.
Well, awesome. Then we do need to do that at some point.
Definitely then.
Yeah, absolutely. There's lots of different ones, that we could touch on because George, again, is a wealth of information. He gets calls from me all the time, texts even, have you ever had this? Did you do this? Like we're back and forth all the time. Yeah.
It's a two-way street.
I know. I love it. Love it. So we'll definitely make a trip over because we have some special treatments for you and your significant other. So
I will be seeing you.
Yeah.
Thank you so much for joining us.
Yeah, thank you for joining us. Any comments, any questions, anything else you want to hear about, let us know. Put it in the comments. Subscribe again if you want to hear more content on improving your sex life or, just sexual wellness, then subscribe so you get alerts to next podcasts and videos. Thank you.